when the patient's sitting in a chair, you have built-in, it's oblique. You have a built-in oblique. So when you're in this direction, it makes it a lot easier for the patient to hold that position. So put your arm like this. Now, one of the things you have to pay attention to is that the adult arm, hold on just a second, let me tell them this, you can get in a comfortable position. The adult arm is longer than a 12-inch film. So that means that you can't see all of the humerus, all of the radius and ulna on one exposure. So it is standard practice to just demonstrate at least one joint and a long bone. Now, your emphasis is not on the joint, but you have to see the joint in order to see the extreme ends of the radius and ulna. And that's the whole purpose of it. So if your patient comes in with an injury or a complaint of pain or whatever reason you're x-raying that patient, and it's closer to the wrist, then you want to include the distal radius and ulna. If it's closer to the elbow, you want to include the proximal radius and ulna. Now that means that you're not going to have, I'm not going to give you a specific point to put the central ray. And I have on everything else we've done. I've told you exactly where the central part of the beam goes. But with the forearm, it depends on which joint you're trying to see. So obviously if you're seeing the wrist, it's going to be closer to the wrist. If you're seeing the elbow, it's going to be closer to the elbow. So this is really important with the forearm that you prepare your space first. Now I'm going to go ahead and position Dr. Zivek here so that we are doing the, seeing the distal radius and ulna. So it's about 1.5 inches from the edge of the film. The condyles are parallel to the film. Now you can help your patient hold that position by putting a weight in their hands. This is a 2-pound sandbag, but you can use anything that has some heft to it. I wouldn't use a 10-pound sandbag. That's probably not a good idea. But the 2 pounds is good. So I'm going to put this in the palm of your hand. And that helps your patient to hold that position. Now the name blocker is at this end of the film. Be careful when you're positioning that film. Make sure that the structures you want to see are not of the name blocker. And it's easier if you put the name blocker on the opposite end of the joint you're trying to see. And that's why I'm doing the distal, because this was already set up with the marker up here at this end. But you would just simply, let's pretend there's no name blocker there. If you were doing the proximal, then you'd be 1.5 inches from the edge of the film for the, from the elbow joint. Okay, you can relax. Any questions about AP forearm?